The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗥𝗲𝗹𝗆 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗹𝗆. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗹𝗆 on 𝗛𝗏𝗃 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗹𝗆 every Monday from 5 p.m. to 6:30 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗹𝗆 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Everybody, and welcome to Healthline with 𝗥𝗲𝗹𝗆. I'm your host, Nicole Jacinto. Today, our topic is goiter. And, maybe we'll talk about some other things that have to do also with the thyroid gland, as our guest is an endocrinologist. Endocrinology is his specialty, and his name is Dr. Jimmy Aragon. How are you, Dr. Aragon?
Hello, hi. Hi, Nicole, and hi to your audience. Good to be here.
Thank you, Doctor. It's a pleasure to have you on the show, and I guess to have you back because I think a few years ago you guested on the show when we were still doing the show in the studio and things live. And I'm glad that at least through the pandemic, we discovered this technology where we can kind of get in touch very fast with each other and even conduct a sort of virtual but face-to-face meetings in a sense. And I'm very happy to have you on the show today, and I'm sure the audience are happy to have you as well. So, Doctor, for today, can you tell us what exactly is goiter?
Okay, so goiter is an enlargement of the thyroid gland. So thyroid gland is located here in our anterior neck. So anytime the thyroid gland increases in size, we call it goiter. Okay. And usually we say there's diffuse goiter or a nodular goiter. When it's diffuse, it's just big. But when it's nodular, you have nodules, or what we call bukol. No? In Tagalog, we call it bukol. Nodules can vary in sizes, and depending on how it appears in an ultrasound, for example, then we decide on what treatment.
Okay, so basically our goiters are located in the anterior or the front of our neck, and goiters, I guess, simply the enlargement of the thyroid gland itself. Yes. And as you said, if it's a diffused goiter, then it's simply enlarged. The thyroid gland is enlarged. If it's a nodular goiter, then there are nodules on the goiter, and they can vary in size. Mga bukol po, sinabi ninyo. So kapag diffused, lumaki lang yung goiter. And someone like you would be able to tell perhaps why. And yung pag nodular goiter, ibig sabihin may bukol sa goiter, at depende rin sa laki ng mga bukol. Is it usually more than one bukol, Doc? Kapag napansin?
Yeah, some people will have just one nodule. Some will have multinodular nodules. So if there are several nodules, we call it multinodular goiter. So more often, what we see are multiple nodules. Yes. It can also be just one bukol.
Okay. Doctor, can you explain a little bit about the relationship of goiter to let's say infections or injuries or something to the thyroid gland? Does it happen?
Well, injury, yes, it can happen. No? So for example, a trauma can cause the thyroid gland to get damaged, no, but those are not common causes. No, a bacterial infection, for example, can also land in the thyroid gland, and it can cause damage to the thyroid gland. But again, those are not common causes. What's more common would be what we call autoimmune, no, autoimmune thyroid problems. When we say autoimmune, our body produces antibodies, no? So antibodies are proteins or substances that attack our own self. So kaya nga autoimmune, no? So those antibodies are supposed to attack the invaders, diba? So for example, you are sick with a virus, or you are sick with a bacterial infection. Your body is producing antibodies to protect your body from these invaders. But in the case of an autoimmune problem, your own antibody is attacking your own cells, and in this case, the thyroid gland. So that's why we call it autoimmune thyroid disease. And there are two, no? Generally two: hyperthyroid, which is sometimes called Graves' hyperthyroidism. That means it attacks the thyroid gland and makes the thyroid gland very active. And there's also what we call the Hashimoto's thyroiditis, or the thyroid gland becomes underactive. So you become hypothyroid. So one spectrum is the thyroid gland is very active, kaya hyper, no? Very active yung thyroid gland, producing many thyroid hormones. While the other aspect of the disease is you are not producing enough thyroid hormone. So the thyroid gland becomes underactive, so we call it hypothyroidism, the opposite of hyper.
Yes. Thank
So
you.
yung most common, yung mga autoimmune.
So the most common cause of goiter is an autoimmune disease. And as you explained to us, when it's an autoimmune disease, we have our autoimmune system is supposed to, attack, as you said, invaders. And autoimmune diseases can manifest in many ways. In this case, when it's an autoimmune thyroid disease, which is the more common cause, as you said, our own autoimmune system is attacking our own thyroid gland.
Correct.
And you said you could have Graves', which is hyperthyroidism, and on the other end of the spectrum, you could have Hashimoto's disease, which is hypothyroidism. So taking it from the word hyper and the word hypo, hyper, you did said you release too many hormones, okay, and with the hypo you release masyadong konti, no? You release, yes.
Yeah.
Can I ask you, there's something that I don't know if it's a misconception or what, so true or false. Question for you, Doc, the expert. A lot of people will say if you have hyperthyroidism, you're thin, like it can cause you to lose weight. And parang, does it also reflect in your behavior? Like, are you hyperactive, or is it just a matter of reflecting in weight loss? And with the hypo naman, is it true like some people will gain weight and they don't know why? Does it affect your metabolism in that sense?
Correct. You're absolutely correct, no? When you're hyper, everything is fast. So you're losing weight, you cannot sleep well, your heartbeat is fast, your metabolism is fast. So sometimes they'll tell you, I have just eaten and a few hours later I'll be in the bathroom.
Yeah.
Because the food has already reached the intestines, no? So everything is fast. While the opposite end would be everything is slow, no? I'm sleepy. You're gaining weight even if you're not eating too much. Your hair is becoming brittle or dry skin. So everything slows down. That's hypothyroidism. But of course, these are the typical examples that we give.
Yes.
But
What
a
are the other
patient,
symptoms? What are the other symptoms, doctor?
yeah, sometimes it's very subtle, no? In fact, we do get patients who are not very symptomatic, no? So sometimes they'll just say, "Doc, I'm feeling tired," so maybe it's just you lack sleep, or sometimes you just feel weak, or you feel under the weather. So not really very obvious symptoms, no? And we do see patients who are almost asymptomatic. So virtually any symptomatology can be hyper or hypothyroidism. So it doesn't mean that you're losing weight, automatically hyperthyroid na. And if you're gaining weight, automatically hypothyroid na. No? So there are in-betweens. But when we give examples, that's how we say it para mas maintindihan, no, ng tao na pag hyper, you're losing too much weight, and if you're hypo, you're gaining weight, no? But in between, it can vary.
Okay. What as you said, no, sometimes it's asymptomatic, like walang symptoms at all, but somebody is already has goiter or hypo or hyperthyroidism. Are there any other, okay, in terms of people who are symptomatic, are there any other like telltale signs that, maybe it's not as extreme as everything's fast and you can really tell, tapos they lost weight and they don't have any other illnesses, or or everything's slow and they're always sleepy? Like, are there any in between also, like symptoms that can be attributed to goiter?
Yeah, so the symptoms that we talked about are about hyper and hypo, right? No, but in between, it can also be normal. That means you're not hyper and you're not hypothyroid either. So you are in between, you're normal. So you have goiter, that means you have enlargement of the thyroid gland, but you are neither hyper or hypo. You just have enlarged thyroid gland, or you just have nodular goiter, you have buccal in your thyroid gland, but you don't have the problem of hyper or hypothyroidism. So that can also happen.
That's why you called it a spectrum, doc. So parang on the one hand, there's the extreme hyper. On the other hand, there's the extreme hypo. Pero in between, pwede ka rin magkaroon ng goiter or have goiter.
Without any symptoms, yes. You just have enlargement of the thyroid gland, or you just have nodule. And sometimes, Nicole, we see this just on yung regular physical examination or an ultrasound. No? So let's say the patient is doing a test for let's say an ear infection, and then he got an ultrasound. Incidentally, nakita, ay, merong bukol. So sometimes that happens, and they don't know it because it's not so big. Yeah. And they come to see us because of that, no? So yung tinatawag namin na incidental finding. So that can also happen.
Okay. And then, of course, doctor, the other way to be able to tell maybe from is like, pag malaki na yung bukol at nahalata na physically, outwardly, na there's a big bump there, then somebody would probably go to you and have it. Okay.
Yes.
Yeah. As you said, the incidental findings, is that how you find most of the cases with goiter that are parang asymptomatic, or, it's not in one or the other extreme?
Right. Especially now that ultrasound is very common. Sometimes ultrasound is incorporated in annual physical checkups. No? Yeah. Then we see more and more thyroid nodules. No? Unlike, let's say, 30, 40 years ago, when ultrasound is not yet very common, we just see them if the thyroid gland is already big. No? But now, because of the advent of not only ultrasound but CT scans, no, we see more of these thyroid nodules being discovered.
And then, doctor, okay, so how do you diagnose that someone, since we're talking about being able to see it or tell, and partially the diagnosis of goiter already, how, aside from incidental findings or having a bump on the front of your neck that is very obvious, what are the other tools that you use, diagnostic tools, to definitively say that someone has goiter or has something going on with their thyroid gland?
Yeah. So let's say you feel something in your neck, a lump, for example, or you want to find out, do I have goiter or not? Of course, the first thing we do is do a physical examination, palpate palpate for the neck and palpate for the thyroid gland. No? And then next is to request for a test called ultrasound. No? Use ultrasound of the neck, which will usually target the thyroid gland. No? So that's for the diagnostic. For the laboratory, we also request for FT4 and TSH. So FT4 are the hormones that is produced by the thyroid gland, while TSH, thyroid stimulating hormone, is the hormone that is produced from the pituitary gland, so from the brain. No? So because the brain or the pituitary gland controls the thyroid gland, no? So parang it commands the thyroid gland to produce thyroid hormone. So let's say you are overproducing the thyroid hormones from your thyroid gland, it will send a signal to the brain. So the brain now will stop producing TSH. So kaya when you have hyper, we diagnose it with having high FT4 and low TSH. On the other hand, if you're underproducing the thyroid hormones from the thyroid gland, no? So your FT4 is low, it will also send a signal to the brain. And so the brain now will react by increasing the TSH, thyroid stimulating hormone. TSH now will be up kasi it's attempting to correct the deficiency. So when you get the lab, the TSH is high and the FT4 is low. So those are the two tests that we do, no? The lab test and the thyroid ultrasound. And from there, we can make a pretty good plan, no, on what to do with the goiter, if there is goiter. It can also happen pala, Nicole, na there's no goiter but you have hyperthyroidism or you have hypothyroidism. That can also happen, no? So parang two different problems siya. You can have a goiter without any thyroid hormone discrepancy, or you can have thyroid hormone discrepancy without goiter. So those are two different things.
Thank you, doctor. Okay, so when somebody, I'm glad you said those are two different things. So I will not mix them up when I talk about them, and neither will the audience. And then also when it comes to the diagnostics or being able to definitively say that you have either that you either have hyperthyroidism or hypothyroidism or goiter. The things, how you diagnose it is one, clinical examination. So you palpate, you use, of course, your hands to touch and feel kung may bukol ba or may nodes dyan. Secondly, ultrasound. And when it comes to the ultrasound, it's a very painless procedure. Patient is lying down, you use the ultrasound device, and I often describe it as it feels like a deodorant roll-on, and then then the technician, thank God for our medical technicians, will just scroll tuloy, parang deodorant, no? Just around your neck area. And sometimes, Doc, you said it's an incidental finding, so somebody could be having it to check, let's say, their carotid artery or something like that, or as you mentioned, ear infection. And then you'll see na, may nodes pala, or, there's something that's not exactly as it should be here. And then the third way is through labs, which is a blood test, doctor. And in the blood test, you will order an FT4 and a TSH. And do you need to fast for that blood test, doctor?
You don't need to fast for that.
That's great, because some people may be hungry and experiencing goiter. Experiencing these symptoms. So at least the people who, if you want to get your goiter tested fast, if you want to get the test fast and be sure, and you go to Dr. Jimmy Aragon, you don't have to fast. So anyway, we're putting it out there. If you want to get it checked, and we'll circle back to that a bit more later. it's a simple blood test and ultrasound and palpation. Okay, so doctor, we do have to take a short break. When we get back, I'd like to ask you about the demographic, or maybe, people who you see an increased incidence of goiter in, or who is at risk of getting goiter, or any other thyroid diseases that you'd like to talk about for that matter. We just have to take a short break, folks. We'll be right back.
Sure.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗥𝗏𝗽𝗵. Available for outpatient care services, our 𝗥𝗏𝗽𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗥𝗏𝗽𝗵 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗥𝗏𝗽𝗵 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗥𝗏𝗽𝗵. Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, Different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. 𝗛𝗵𝗹𝗁. Our topic for today is goiter, but we have also discussed hyper and hypothyroidism. And I guess, we can talk about all things thyroid if Dr. Jimmy wants to do so. Okay, doctor, we were just talking about like the diagnostics, how you diagnose goiter or even hyper and hypothyroidism. We are talking about the symptoms. Sometimes you can be asymptomatic. Sometimes the symptoms, for illnesses like this, you can tell with certain types of people, like everything's fast, or their metabolism and all that. Can I ask you, doctor, is there a specific demographic, or do you see a specific type of demographic coming into your clinic now? You did mention earlier that 30, 40 years ago, a lot of people would have goiter and not even know it, or maybe have nodes on their, thyroid gland and not even know it, and it would go underdiagnosed. Do you see basically what are the kinds of patients that you see nowadays?
Yes. So there are some characteristics, or people who may be more prone to having goiter or enlargement of the thyroid gland. One would be those who have iodine deficiency. Kasi especially before, before 2000 or maybe in the 80s, marami pang iodine deficient areas. And if you lack iodine, there's a tendency for you to develop goiter. But because we already have a law saying we should have iodine in the salt, in yung mga bread, then the iodine deficiency in the Philippines has already gone down. So hindi na tayo iodine deficient. So iodine deficiency as a cause of the goiter has gone down, but that is a risk factor. Another would be female. So if you're female, more females get goiters compared to males. So when they come to the clinic, pag mga females, they are more. They have the tendency to develop goiters. Pregnant patients also, yung mga nabubuntis. So sometimes they will say, nako, dahil yan umirik ka, kaya lumaki yung thyroid gland mo. But that's not true, it's the hormones that causes the thyroid to become enlarged, So those are some of the characteristics or demographics, Also age. If you are older, 40 years old, more than 40 years old, it's more common to get goiters, especially mga nodules, yung mga maliliit na nodules. So that's very common. If you will be able to do ultrasounds on people above 40, most probably you will see some kind of nodules. So age is also a risk factor, and some medications. For example, may mga gamot for heart, for example, yung amiodarone, that may be more likely for you to develop thyroid discrepancy, hyper or hypothyroidism. You usually we ask for in the history taking if they have goiters.
Okay. Thank you, doctor. So yeah, the law, I think that you mentioned that first you said like maybe 30, 40 years ago, the country in general was iodine deficient, no? So, I mean, the population. So there was a law passed in the 90s, I believe, wherein all salt had to be iodized. I'm not sure about the other products. For some reason, this was something I remember just coming across it years ago. I was into salt at the time. I mean, reading about salt, something I love very much that I have to cut down on, or that I have cut down on already. So, I'm weird like that. I just read about the history of salt and whatever, and there. As it came into play now, yeah. So there was a law that was passed, and so I guess you mentioned bread, so it must be also in other food products. Also, doctor, in terms of you'll see it in people who lack iodine or iodine in their bodies, and I do remember in grade school, don't ask me what decade that was, that, we would talk about, you need iodine and what are the sources of it and da. So yeah, okay. And then now that we're not, I guess, as deficient, our population isn't as iodine or iodine deficient as it was. It's mostly females who you see coming into your clinic and who are more susceptible or more prone, as you put it, to getting goiter. And I guess it's female, and then of course you said women who are pregnant, so they have to be female, and it's, as you said, no, one misconception that people have, and we'd like to take it out. Hindi totoo yung dahil sa pag-iri mo, lumaki yung liig mo, or nagkaroon ka ng goiter. It's because of the hormones. And we all know when women get pregnant that the hormones can change. So I don't, that must be it. And then, as you said, doctor, age can also be a risk factor. And is it age for just females or mostly females?
Even for males, yeah. Yes.
So, all right. I have you don't have to answer this question because it's just speculation. But I was wondering if in our population now, also maybe because of the age, like maybe before the law was passed, you're iodine deficient. Does it work that way, or once you correct the deficiency,
usually if you correct the deficiency, you should lower your risk.
Okay.
But if your thyroid gland is already big, sometimes it's difficult to correct. Diba? I see people who have very big goiters, no? So pag ganun nakalaki, it's already difficult to correct it with nutrition, no?
Yeah.
So that's why it's important to get an early checkup, so that you will be able to find out what measures you can take to prevent it from becoming very big.
And as you said earlier, once you, doctor, or another endocrinologist have a clear picture of what it is that's wrong with a person's thyroid gland, you can make a plan.
Yes.
You can make a plan to correct it, treat it, help help the patient, and we'll get to treatment in just a bit. You mentioned medication, heart medication. Is that that could be a cause of developing nodes on the thyroid gland?
Maybe not directly, no? Because let's say your medication made you hypothyroid.
Okay.
Meaning nag-underactive, no? Yung thyroid gland. So the TSH goes up, and sometimes that can stimulate the thyroid gland to become bigger, no? So hindi direct effect of the medication.
Direct effect lang because of all your body. Okay.
Yes.
And is that medication for would it be antihypertensives or different kind of heart medication?
No, not antihypertensives. It's a medication for arrhythmia.
Arrhythmia. Okay. Yeah.
Or yung mga thyroid medication, like yung mga methimazole, yeah, those can sometimes cause the thyroid gland to enlarge.
Okay. So let's say you have a condition already with your thyroid and you were prescribed thyroid medications, pwede rin na maglalaki rin yung thyroid gland dahil dun sa medication to treat one specific aspect.
Yeah. That's why we have to monitor. No? That's why we monitor. We usually ask them to come back every quarter to check the thyroid hormones so that we are sure that you are getting the correct dose. Once you get the correct dose, then we just ask them to see us maybe every 6 months or even once a year, just to see whether the thyroid function is still within normal limits.
So doctor, would you recommend having your thyroid gland checked as part of your parang yearly checkup? You know, like whether through the ultrasound and the blood test or both? Would you recommend that to the general public?
It's not recommended.
It's not? Okay.
It's not recommended. Oh, kasi who will pay for it? Kasi we were talking about public health. If you're gonna recommend that, that means the government should be able to pay for all the FT4TSH ultrasound, no, and it's not going to be practical.
Okay.
So we target certain demographics. So like what we've talked about, no, you get a lump, you have symptoms, and those are the people that we test for thyroid, but not everybody.
Not everybody, okay. Or at least kung may, if there's an incidental finding and you have nodes and you discover nodes, but you know, everything's okay, those are the patients that you ask na come back and monitor.
Yes.
Thank you, doctor. All right. So, I was thinking also, no, we as we get older, we are told to lay off the salt. And then, yeah, so maybe we should, you know, I don't know, just salt. I don't know why it interests me.
You can get iodine from other sources. It's not only from salt. So, meron yan sa fish, meron yan sa dairy, meron yan sa seafoods. So, hindi naman kailangan salt ang iodine.
Kaya nga iodized lang yung salt, nilagyan lang ng iodine. Pero pwede naman from other sources, as you said, fish, probably shellfish is high in it. But if you're allergic to certain types of shellfish or whatever, ayan, you'll find a way to manage it na lang with your doctor. And you can ask advice on what the other sources are. I'm sure there's some vegetables thrown in there somehow, as we always tend to discover during our discussions. Vegetables are always included in a healthy diet. Okay, doctor. So, once you find out, once you find out that, okay, can goiter, we're already talking about like, maybe we talked about how to diagnose it. Can you tell us how you treat goiter?
Okay, so again, depending on the situation, no. So let's say there's a nodule, no. So we ask for an ultrasound, and depending on the characteristic of the nodules, we give recommendations. So of course, what we are afraid of in this situation is if the nodules will turn out to be cancerous, no? And again, there are clues based on the ultrasound findings. If, for example, there is calcification, if the nodule is increasing in size, no? Or there are other characteristics that we look at, we recommend what we call a fine needle aspiration biopsy. So that means sticking a needle to the nodule and then looking at the histopathology, or they look under the microscope to see what kind of nodule is in the thyroid gland. No? So if it's suspicious for cancer, then we have it removed. No, cancer is not very common.
Okay.
In the nodules, no, in the thyroid nodules, no. So the vast majority will be benign, no, but it's difficult to say, no, who will have malignant nodules or benign nodules. So we look at characteristics, and after we look at the characteristics, we send the patients for biopsy to confirm our suspicion. So if the suspicion is correct, then the next step is to have it removed, the nodule.
Okay.
This is a surgery called thyroidectomy. So you remove the thyroid gland.
Okay. So you remove the thyroid gland, doctor, and how about if it's do you ever remove a goiter if the nodules or the bumps are if they're non-cancerous and it's just big? Do you ever?
Yeah. So especially if they're very big, no, pag more than 4 or 5 centimeters, we usually also recommend surgery. Kasi nga, there is a danger that it might become obstructive later on. Siyempre, as you grow older, it will be riskier to subject yourself to surgeries, no? So if it's already big, sometimes we also recommend surgery. So that also happens, no?
Sorry, doctor, go ahead.
Yeah, well, this is about goiter, no? Earlier, we talked about hyper and hypothyroidism. So, if you have goiter and you have hyperthyroidism, we also manage it with medications, no? So, yun nga yung I alluded earlier about a medicine called methimazole, no? So methimazole or PTU, those are medications that we give to patients who have goiters and hyperthyroid as well, no? So it depende again on what we will see in the ultrasound and in the lab test, the FT40SH that we talked about. So it can be, so in other words, it can be medical. We give medications, or it can also be surgical. There is also another modality, yung tinatawag na radioactive iodine. Radioactive iodine is a capsule or sometimes a liquid that we let the patient take. We give this for hyperthyroidism naman, no? So because the iodine is radioactive, it will go to the thyroid gland and it will destroy the thyroid tissues, no? And if the patient has hyperthyroidism, we also sometimes recommend this instead of surgery, no? So pag hyperthyroid, it can be medication or radioactive iodine.
Okay. And doctor, this radioactive iodine, do you inject it in the body?
No, you just take it orally.
Orally. Okay. Actually, doctor, I remember a friend of mine asked me about a month ago if I knew of an endocrinologist. So hope you don't mind if I send her to you, if I recommend
Sure.
her. Okay. All right. Thank you. Okay. So, and I think she had hyperthyroidism and that was her issue. So yeah. Okay. So thank you for explaining to us, different ways of treating either hyperthyroidism, goiter, and just about the surgery. I just like to ask or clarify something. Of course, you said the older you get, the less you want to avoid surgery. So let's say you're like in your 40s or something, or maybe even 30s, and you have a big bump there, big goiter. Whether it is, cancerous or not, I asked you if you remove it through surgery. And you said, yes, you do sometimes because it can become obstructive. Because some people might think that it's just a cosmetic issue. So, and then they'll say, hindi, ayoko tong ipa-opera kasi gusto lang tong tanggalin ng doktor. Wala naman akong pakialam kung pagtawanan ako. I mean, basically some people say, no, it just, I don't care if there's a bump on my neck. If I don't need the operation, I won't get it. But I'd like to hone in on the point where you said it could become obstructive. So meaning if it keeps growing, you might have trouble swallowing, things like that later on.
Yeah. Yes, but this is not very common kasi nga the vast majority of the nodules are not big.
Okay.
But sometimes we do get them that when the thyroid mass is becoming bigger, or sometimes they are growing substernally. Yung it's not very obvious coming out here, but it's growing inferiorly to the chest cavity. So in those conditions, we might need to remove it. Of course, we have to discuss this with the patient. It's never 𝗛𝗲𝗃𝗏, no. We have to look at all the circumstances before we recommend any surgery. But these are just parang overview on what to expect if you have this kind of problems. But other things, of course, like if you have comorbidities, if you have a heart problem, so we should all take this into consideration.
Thank you, doctor. I have just come across a number of people who, have gone through this. I don't know them very well, but there were times that I spent with them, and so I've heard all of these comments or doubts or fears. And the way you're putting it now, it's really not a cookie cutter approach. Tama yung sinabi mo, hindi dekahon. It's applicable to every patient as an individual. So best thing to do is really get the examinations, listen to your doctor. And if you're not that convinced, because some people will just go to, let's say, a general clinic. And I'm not saying the doctors there are not good, or they'll go to a public health clinic, and then they'll immediately get a diagnosis to whether remove it or not, or, no other test, then get a second opinion. Just reminder ko lang po, because that, we're giving ourselves surgery. Okay, so that is basically, when you treat goiter, you can do it, as you said, through medications, medically through medications. There are instances where you do surgery, and the other way is to also monitor, monitoring and following up with the patient, following up with the doctor, actually, if you've been diagnosed with goiter or any other thyroid condition for that matter. Okay, doctor, can goiter be cured?
Yes, kasi if you remove the thyroid gland, cured ka na. Wala ka ng goiter.
Wala ka ng goiter. Can it be prevented?
Usually, when we say prevent, kapag autoimmune, pag iodine deficient, if you have iodine deficiency and you have goiter because of iodine deficiency, you can prevent it by taking enough iodine, either from iodized salt or from food, seafood, fish. But yung mga autoimmune, there's nothing really we can do to prevent it. Maybe manage your stress, because sometimes the autoimmune diseases will flare up if you are under a lot of stress. So managing your stress sometimes might help. I do get patients that they're okay, and then suddenly there's a big stressor. Like if you get sick, then the hyperthyroidism will again come back. So, but it's difficult. Of course, it's easier said than done to say na manage your stress. But those are the things we can do.
Okay, thank you, doctor. I mean, I know manage the stress part. I need help with that. I think a lot of people would, or a lot of people do. And by the way, doctor, this is double chin lang ato. See, double chin lang. Double chin lang. Okay, so those are, as you said, you can prevent it by, maybe managing your stress or whatever when it comes to some factors. But if it's an autoimmune disease, you can't really give us tips on how to completely assure that we can prevent it. But
Yeah.
it can be cured. Kasi pag tinanggal yung thyroid gland mo, wala ka na rin goiter.
Yes. Pero yung mga hyper and hypothyroidism, usually we treat them medically, no?
Medically,
So let's say they are over functioning. Their thyroid gland is over functioning. We just give them medication to calm down the thyroid gland, and usually they stay normal naman.
Yeah.
No? So I don't know if kasi pag cure wala na, no, absence of disease, no. So but it can recur.
Cure is not the right word, but you can manage it.
Yes.
Okay, if it's medication, you can manage it.
And then pag hypothyroid, again, you just give thyroid hormone medication, and once the thyroid function is normal, then you have managed your thyroid problem already. But it can recur, no? Meaning, let's say you forgot your medication, you were not able to buy it, then you can become hypothyroid again, or you can become hyperthyroid again. But if you're taking the medication and your thyroid hormone is normal, then you have managed it. I don't know if that's cure already, no, pero wala ka ng disease. So if definition is absence of disease, then yes, you have cured it. Pero you need the medication. So baka hindi. Kasi pag cure, dapat wala ka ng gamot.
Wala na.
You're not taking any medication and the disease is already absent. No? So maybe you have managed it because you are taking medications.
Thank you, doctor. At least, and then I guess take the medications. Pag nawala, you'll know naman by going to your doctor, mga follow-up. And maybe people who have had hyper and or hypothyroidism for most of their lives, they can also start being able to tell within themselves and when their own symptoms manifest. Yeah. Okay. So, okay, doctor, you've told us what treatment options that are available for goiter. You've talked to us about, how to manage also, whether it's having goiter or hyperthyroidism, which are different things. But since we're in that area of the body, the thyroid gland, you've told us all about that. Can I ask you, doctor, what complications can happen if either it goes underdiagnosed completely, or you're starting to get, for whatever reason, you're starting to get symptoms, and then I know some people will say, hayaan ko lang yan, I won't treat my goiter. Don't feel like going to the doctor for it. What can happen if you leave a goiter untreated?
Okay, so if it's just goiter, meaning enlargement of the thyroid gland, and the nodules are small, and they are not cancerous, actually, wala naman.
Wala naman, okay.
No? So we just need to know if some of these nodules are cancerous, because if they are cancerous, of course, it can spread to other areas of the body, and especially if it is the aggressive cancers, no? But ang maganda sa thyroid cancer, most thyroid cancers are also not aggressive, no?
Yes.
Now, if you have hyperthyroidism also, no, or if you have hypothyroidism and you don't treat it, it can affect your heart, no? And sometimes it can lead to heart failure.
Okay.
Now, on the other hand, if you have hypothyroidism, meaning your thyroid gland is underactive, no, and you're not treating it, again, it can also affect the heart, no, and sometimes yung memory can also get affected, especially very severe pag hypothyroid. For hyperthyroid, the bones can also be affected if you are hyperthyroid, no? And of course, yung nutrition, no, kasi you will not be able to gain weight. Sometimes you will have loose stools. So you can become malnourished also if you are hyperthyroid. No? So better talaga that you'll be checked if you are suspecting you have thyroid problems.
And if someone, doctor, suspects that that they may have goiter, or they're at risk of developing goiter, or even hyper or hypothyroidism, you would advise them to get checked immediately by a doctor like yourself, or they should.
An internist will be able to manage a thyroid problem, no? So of course, endocrinologist also.
Yes. Yeah. Okay. Thank you, doctor. I just thought of another patient for you. So I'm gonna ask for your number after the show. I just thought of another patient for you. Okay. Aside from all that, doctor, can you just give us, the audience, any general tips on whether it's, a change of lifestyle or diet, or, whatever it is, on how to sort of be, or checkups, anything that you can think of, just advice both to those who have goiter or hyper or hypothyroidism, and also to those of us who wish to not contract this illness.
Okay, so unfortunately, as we've talked about earlier, it's difficult to prevent this from happening, no? Lalo yung mga autoimmune thyroid problems, no? But if you do get them, don't worry, because it's fairly easy to manage, no? We usually just use medicines to manage these problems. If you have goiter, if you are suspecting a lump in your neck, just go see your doctors, have an ultrasound, and most probably naman these are not scary nodules, no? As I've said, thyroid cancer is not very common, and if it is cancerous, thyroid cancers are usually not aggressive. No? So just have it checked, just to make sure that you are properly managed.
Thank you, doctor. Thank you so much for your time. Thank you for the effort that you gave to answering the questions, and for allaying our fears about illnesses that affect the thyroid, and also for informing us about the things that we need to know about to take care of ourselves better. Thank you for being on the show today.
Thank you so much also for having me, Nicole.
Oh, it's my pleasure to have you on the show, doctor. We're going to say goodbye now to the audience because we're out of time, and see you next time on Healthline with Makati Med. I'm your host, Nicole Jacinto.
All right, bye.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.
If you like listening to our stations, DZRJ 810 AM and RJFM 100.3, there's no excuse not to listen anywhere and wherever you want. Listen on your phone or computer anytime, anywhere in the world. Just download the app for free. How do you download? If you have an Android phone or tablet, go to Google Play Store. If you have an iPhone or